Now, it's a problem that affects 1 in 4 Kiwis. 1 in 4. Yet it seems many still struggle to actually ask for help on this. And it's not just a problem, it's a big issue. This week is Fertility Week, and joining us now is international expert Jan Roberts and also former fertility patient Erin Gascoigne. Thank you guys for coming in, much appreciated. Jan, first of all, I want to talk about, I mean, there's no doubt that fertility and the issues surrounding it are a growing problem.
Absolutely. When I started in this area, which is more than 30 years ago, we were looking at maybe 1 in 6, and now I see 1 in 4. That's in the space of 30 years.
It's extraordinary, isn't it? Here you go. The average sperm count in the 70s was 120 million per millilitre. Now it's 20 million on average.
That's considered average now, yeah. So 120 million in the 70s, and it's just a massive, rapid decline. But it's, yeah.
And Erin, well, you know more than most about this, and thank you for coming along and talking to us, because this is one of the hardest things of all, isn't it? Particularly for Kiwi men to say, hold on, I've got a problem here.
Absolutely, and Kiwi men need to stand up and say that, because they do make up 50% of the equation. Let's be honest, and they're so precious about their fertility health that they seem to think that their testicles are made of titanium and they've got Superman written on them, but they're not. Oh, Sam does.
But Erin, on a serious note though,
yeah.
What impact did it have on you and your life?
Oh, mental health, marriage issues. It is a really horrible time in an environment when your fertility is a major issue within the household.
Jan, what are the main reasons? Why is this decline?
21st century lifestyles. And you know, one of the major things when you're talking about that huge decline, mobile phones in pockets, laptops on laps. And blokes have all got them there. But that's one of many things. Alcohol, cigarettes, poor dietary choices. I mean, the list goes on.
And that's why, Erin, you thought, hold on, you thought, hold on, I can actually do something about this.
Yeah, it was the good old Kiwi number 8 wire story scenario. I mean, clinically, I don't come from a clinical background, but engaging people like Jan and the guys at AUT and things like that, yeah, I basically put together something that was to help me create a little 4-year-old now, Ava, who's running around like a mad shop.
So you talked to the Jans of the world and said, give me all the reasons as to why this could have happened to me, and then you thought, hold on, if I put together some sort of, I don't know, health...
yeah, just a dietary supplement. Yeah. That's essentially it. It's selenium and zinc, you know, and absolutely, and it's working all over the place now. So
it's extraordinary, isn't it? I mean, Jan, so we talk about the diet and that sort of thing. What else can we do as a community, as a country, to reverse these trends?
Well, I think we need to be educating people first of all. It needs to start with teens, because they need to know that the choices they're making, you know, whether it's a lot of smoking, drinking, and drugs, and burning the candle at both ends. Stress is a huge issue. We were just talking about that this morning. It's one of the major drivers of infertility in both male and female, and we're all plugged into it.
Yeah, because I was going to say, you know, the smoking and the drinking, I mean, generations have been through that, far more so than maybe the present generation. But the stress thing is probably something which is slightly new. Erin, your advice...
My advice
to couples, if they're sitting here right now saying, we're going through this.
My advice is, I'm actually looking at, in the age group of the 20s, we're going through, I'll wait for our career, buying a house, doing that, all that sort of carry on, before I start thinking about my fertility and that journey. Get into it now. Don't muck around.
Because age is a big factor, isn't it? What was it? And here you go, back to the 70s. The average age of a mother was 20, now it's 32.
Yeah. I would say, though, if you were looking at making the right lifestyle choices, changing your diet, stepping up your supplementation routine, because it's got to be really robust, because you can't necessarily support reproduction with the diet that's supporting adult life. It's that simple. So you need help, and you need to start as early as you can, as Erin's saying. Don't wait. I mean, if you want to put the clock back, yes, do all the right things, but get onto the program now.
And if you do want help directly, I'm going to look at you, if you're watching this now saying, I really want all the advice I can get. Jan's actually giving a free talk this evening, 6:30. If you're in Auckland at the Spencer on Byron, that's in Takapuna, it's not going to cost you anything. You can go along and have a chat with Jan about this. And if you want a bit more advice on this, www.fertilityhealth.co.nz.
Absolutely, and you go onto there to log on to Jan's tonight as well. So,
and I think you can find out a bit more about the product.
Absolutely, you can find out about Vitamenz and Vitamenz.
All right, Erin Gascoigne and Jan Roberts, thank you both very much for coming in.
Thank you for having us.
Sam and I have just been exchanging a few worried looks doing this.
You worry so much about things, and I was thinking while I was chatting about the demographic, I'm going, well, I wouldn't worry about you, Sam.
At first I thought she was looking at me like, do you
Shall we make a baby?
Shall we do it? Yeah, and I was like, oh, no, I see what you're saying, yeah. We need to get on with it. Yeah.
Not together. Coming up on Breakfast.